If you're clicking on this video, either you already have made an appointment or you're thinking about making an appointment for your knee pain or knee problems, or maybe you have a loved one that's doing the same or in that same process. What I want to do is I want to give a short introduction as to a little bit about why we do what we do, a little bit about why it's so important to take a restorative function towards that knee instead of just jumping to drugs and surgery. And then the third thing, a little bit about how that first visit, what that's going to go like, and maybe what a little bit of the treatment actually occurs. And again, that's going to be different for everybody, but I want to give you kind of an idea to help you to understand. It's not just sending you home with some exercises. It's not just wait and see. It's not just make this feel a little bit better until you can buy time for surgery. There's nothing that can be done, or it's degeneration and it's just going to have surgery. I'm here to tell you that's not always the case. Osteoarthritis, degeneration, bone on bone. One of the big things that people often say is, I've been told it's bone on bone. There's nothing that can be done. In fact, it's usually not the case. And the other factor that we talk about is the sooner you do something about a knee problem, the more likely that you're going to be able to be helped. And so this is where I really want to encourage people not to wait, to get in there, get the work done, and then support and maintain the progress and the function that you've made to give you a much better quality of life. And I realized, we put a lot of emphasis on the health of your spine and the nervous system because that controls and coordinates all aspects of the human experience. We put a lot of time into helping people with food and nutrition, figuring out the underlying triggers behind their diseases or their problems. But one of the things that I hadn't been really taking care of, or maybe dismissive or would refer out for, was knee problems. And I believe that there is a lot more comprehensive approach that people can benefit from. And that's what we strive to deliver here today. Our intention in these first two areas is where we can still help people. Once it gets out into this area here, the likelihood of us helping you is not so great. The treatments we do, they're not there to make you feel better while the problem continues to progress. What the treatments we look for is what can we do to increase function and to help to stimulate a healing event in the body.